Cauterization, sealing a wound with a red-hot instrument in an attempt to keep from bleeding to death. This time-honored treatment of action heroes everywhere is both effective and very dangerous. While the practice will help seal your wound from blood loss, called exsanguination, it will also leave you extremely susceptible to infection. Before you play Rambo and choose to use this method, let's talk about why it works and why you should probably never try it, unless you find yourself bleeding to death in the middle of nowhere and no other method of stopping the blood loss is working. Cauterization as a medicinal treatment can be traced back to Hippocrates in the 5th century BC. These early healers used the method to stop bleeding and infection in everything from amputations to the surgical removal of cancerous tumors. While modern medicine now knows the treatment actually worsens a person's risk of infection, it does stop bleeding by heating up the tissue and blood, causing it to coagulate or clot. It does this through a process called protein denaturation. When proteins in our skin and blood are exposed to extreme heat, they lose their original chemical structure, causing them to cease their normal cellular functions. The result is numerous abnormal characteristics. The two that help stop bleeding are the protein's loss of solubility and the clustering together of what are known as hydrophobic proteins. The clustering, called communal aggregation, causes the proteins to bind together tightly, not allowing blood to pass through. This is also the same reason eggs harden when you cook them. In the movies, when the action hero cauterizes his battle wounds, they never seem to show what happens afterwards, namely, infection. Using heat to sterilize objects and kill any bacteria present is very effective. The problem with using this method on live human tissue is the 2nd and 3rd degree burns. These burns leave a perfect environment for other outside bacteria to enter your body. Numerous studies have shown you are more likely to get an infection from cauterization than the treatment would have prevented in the first place. If you're not willing to leave behind this medieval approach to medicine, declaring yourself a man in a way only conquering knights might have known, never fear. Technology and modern medicine have combined to provide us with many ways to use cauterizing's beneficial effects while leaving behind its negative ones. Doctors currently use 2 different methods of cauterization to help in a number of unwanted medical ailments: chemical cauterization and electrocauterization. Chemical cauterization uses caustic chemicals to heat and sometimes cool the affected tissue, giving us the desired result. Electrocauterization heats the tissue with electricity. Both of these treatments come with a low risk of infection compared to other methods. In the end, if you're shot by a fellow hunter in the wilderness of Alaska and you feel like Rambo, cauterize your wound with the knowledge that modern antibiotics will help the inevitable infection. Just don't forget, direct pressure and bandages will work better in most cases. Impressing your friends by burning your wound may seem manly, but dying 5 days later of systemic infection might make you feel like an idiot.